Let me now welcome to the podium TM Dr. Sumant Mishra to give his speech, and his speech is being evaluated by our President TM Sugna Ganeshan. TM Sugna Ganeshan, please take up the floor.
Thank you so much, Toastmaster of the Day, for the welcome. My target speaker, Toastmaster Dr. Sumant Mishra, is embarking. Sorry. Embarking on his level 4 project in dynamic leadership. His purpose of this speech is for the project is for the member to practice the skills needed to address our audience challenges when he or she presents outside of the Toastmaster of the club. The speech length is 10 to 15 minutes. Unlocking audience alchemy. Toastmaster Sumant Mishra. Toastmaster Sumant Mishra, unlocking audience alchemy. Over to you.
Over to you, TM Dr. Sumant Mishra, for your speech.
Mother Teresa was the best doctor in the world. Yes? No? Maybe. No. Mother Teresa never used to cure using pills, nor did she give bills. She had a special tool. You know what was that? TLC. T as in tender. No, not Tinder, tender. L as in love. C as in care. So our mantra, TLC. Good afternoon, evening, my fellow Toastmasters.
Doctor, can you? Doctor, please come forward. Your projector is disturbing you. Thank you.
Thank you. I'm sorry. Maybe I cannot see the online viewers as well. Thank you. So, audiences are very special. And to deal with our audiences, we need to have special chemistry between us and the audiences. And knowing and unlocking the psychology of our audiences needs a lot of patience. Of course, TLC as well. Being a pediatric dentist, my target population, audiences at work are mostly kids, less than 6 years of age, in my ministry hospital. Do you guys love dentists? How about kids? No, I don't like. Exactly. The kids, Mabi, tabi basnan, Mabi, I don't want dentists. And my heart tabi basnan, I don't love the dental doctors. Doctor, I love the kids. Exactly. You are right. You love the kids. I love the kids. That's why I'm a pediatric dentist. But the kids don't love. Most of the kids say, I don't like doctors. Yeah. So Way back 1962, Frankel devised a classification of pediatric psychology, grading from F1, which is totally negative, to F2, partial negative, F3, getting better, positive, F4, the best kids, definitely positive. And we deal all kind of personalities like this, ranging from F1 to F4 being the best ones.
Doctor, do you know Arabic? How you are dealing with your kids?
Yeah. Reminds me of Vasta, vitamin wow. Vitamin wow, when I learned first time, people told me, oh, you don't know, being a doctor, don't know vitamin wow. Then they taught me vitamin wow is vitamin Vasta, which is recommendation. So I started learning Arabic because of my love for the kids. Little shoy. Good question. Now, being a pediatric dentist and being in this culture, we have to know the language, we have to know our target population. We should strive to learn the local culture and the languages. Then only you can speak to a kid under 6 years of age, and you can engage your audience. Once you know the target population, and once you know your own capabilities, then there is no fear of failure. You are the boss. You are the boss.
But if you are talking about the population audience awareness, how do you think that it is safe for our interest, the dental things?
Yeah, they all come to us. Being a pediatric dentist, they all come to us.
But you can share something different. No? You don't need to have this session of.
Yeah.
So practical. Yes.
You are right. I'm trying to simplify it, and these aspects can be applied in our general life, in our Toastmasters life, in our outside the work profession, like knowing the psychology everywhere. It's not only dentistry. I'm trying to give examples of dentistry. Might be technically tough.
No, I would suggest you still stay with the tolerance, love, and care.
Yeah, good. So, going back, yeah.
Ask you a simple question. How you convince kids not to eat chocolates?
Yeah, actually, excellent point. Yeah. We cannot stop them totally, but we can try to minimize the frequency, and then we can try to convince the parents to give it at certain times, like with meals, so it neutralizes the effect. Good question. Now let us proceed with the speech, thinking about the time constraint. But we can put the questions at the end. I will be happy to answer all of you, or maybe at the break time, we'll be happy to answer. So now, coming to the psychology. When my kid comes, the moment we
Nobody is understanding what you are talking about. You have to come to our level to make them
Yeah,
understand.
good points. Yeah. Last time, I was in one of the competitions of division level competition of Toastmasters Club. When I went there, I tried to gauge the audiences. I tried to find their culture, their language. And then I realized many of them are very comfortable with Arabic language. I immediately shifted my goal to the target population, to suit the target population, Arabic personalities. And I started talking mostly about Arabic things and mostly about the profession there, and we are together. So we start collaborating more and engaging the audiences more. Now, talking about the child psychology.
Why you want to engage the audience so frequently? Why do you want to use the Arabic language? Why you need it at all? I don't understand anything what you're saying, Dr. Sumant. Why do we need Arabic? Why do we need to understand the language? Why do you want to engage? I don't understand anything.
Yeah, you are right. You are absolutely right. This point we will take into consideration. But being in the local area, when let's say I am dealing with Arabic population, dealing with their language. If I
I'm still not able to understand whether you are a dentist or a psychologist.
excellent question, guys. Kudos. Three cheers. Yeah. Good question. So it's about pediatric dentist. The pediatric dentist, child dentist should know the first chapter is learning the psychology of a kid. If unnecessarily you are not aware of the psychology, you will not able to treat the patient, you will not able to make him or her sit on the dental chair. So that learning of the psychology and learning of the language, these kids under 6 of age, they don't know English, most of them. They don't know
Why they need
Hindi,
chair?
Malayalam, all these
Doctor, why
things.
they need chair? They can stand and check up. They don't need chair. Kids don't need chair. Kids don't sit on the chair. Sorry, I don't accept it.
Yes, maybe you don't accept it, but there is some protocol, there are some protocols, there are some special laws, protocols. We have to follow that, because otherwise it will not be a dentistry, it will be a quackery.
Kids doesn't understand the protocols at all. I don't
We have
understand.
to make them understand behavior shaping the tools available with us. So we have to make them understand, not other personalities. So we will use a lot of tools. We have special tools of behavior shaping, like tell, show, do. We show them from the beginning only. When they come to the, when we receive the patients outside in the dental clinic, and they are not willing to come inside, we try to distract their mind.
These tools are scary to the children. They need toffees, chocolates, popcorns. This will entertain, this will attract, this will invent. But these tools will scare them. I don't agree.
Yeah, you're right. These tools are the ones we are going to use step by step. So we have stickers, which unfortunately I don't have right now. We have some cartoon characters, which unfortunately I don't have, but we have special toothbrushes also to motivate them. We have special toothbrushes of girls or the guys, boys. So when we introduce them to our clinic, we don't straight away jump or make them sit on the chair straight away. We try to stoop their eye level. Khalid, in the Kuliyum Farash, one of my Farash Islamic, when you stoop their eye level, when you're talking to them, they are more at comfort zone. You're not making them sit straight away onto the chair. And then, if you're addressing them with your verbal, non-verbal communication skills, polite, using all the techniques, tell, show, and do. Let them be empowered. Give these tools to them. Small children's toothpastes, small children's brushes, not chocolates. I will not give chocolates still, sorry. So all these little showy, small things will count at the end, and then we gain the confidence of a child. Once we gain, yes please. Are you okay? All right?
You are a psychologist, right?
It's fine, no worries. So we can talk about the questions once again at the end of the session, or maybe in between the break, during the break time. Once again, the psychology. These kids, not only at your work, maybe at your home. If you know the psychology of an audience, my audience being the kids, you will be the winner at every step. And
do you think that psychology will help you for all the patients?
definitely very good question. You know what is this? 5 fingers. Do you think they are same?
It's not same.
Excellent. So maybe you got the answer. You are right. Very nice.
But what
Yeah.
you are talking about the psychology only to observe the patients. That is not the case.
90% inspiration from the psychology, 10% perspiration by hard work. Your diagnosis 90% is complete when you know the psychology of personality. Now coming back to your question, Toastmaster Wafiq Anwar.
Toastmaster Sumant, what is psychology? What is psychology? What is
Yeah.
interest?
1 minute, please. Let me answer Toastmaster Wafiq and coming back to you. Toastmaster Wafiq, 5 fingers are not the same. So whatever the formula we are giving is not applying for all, but we have to be flexible. Sometimes mix and match. So in that ways, some of the tools will work for this kid, some of them for the other one, but we have to be flexible to mix and match. I hope you get the answer. Thank you. About you, once again, sorry. Psychology is mind reading. So when you read the mind of a person, you know the needs and expectations. How can you read them? With the psychology, and you follow this psychology in a structured way, and then you can keep asking. Like first question is in psychology, keep asking and be a good listener. This also applies in Toastmasters. When you are a good listener, you will be a good accounter, grammarian, you can catch the mistakes. In the same way, when you listen to them using all those psychological tools, it will help you.
I'm asking you as a psychologist because you said to ask as a psychology, ask questions. I'm asking you one question. How
Yes,
does
please.
it differentiate between tools for the children? Why tools are required for the children? What psychology children will understand?
Tools is not only those gadgets like these tools, physical tools. Tools can be verbal, non-verbal communication skills, empowering them also. Now, all these tools cannot be generalized for everyone. And once we analyze the psychology, the job is done. And then we will again say, we don't look like inverted Batmans, but we will say the word impossible itself says, I am possible. This is my little session on
Okay,
the
using my
alchemy of the
psychology, I will
audience.
say,
How
I will
about
say
you?
resilience. I will say resilience to the children. Will they understand what is resilience?
My time finishes
No.
now. Over to you.
No.
For the day, please. We'll answer you
Thank
at
you.
the end. Thank you.
Thank you, TM Dr. Sumant Mishra. That was a great speech. Yes, it spoke about resilience, and you did not stop, you did not quit, you just gave your speech.
Now let's move to the next speech, which is of Toastmaster Dr. Sumant, and we have Toastmaster Suguna Ganeshan to evaluate. I request Toastmaster Suguna Ganeshan to give the evaluation speech of Toastmaster Sumant Mishra, Dr. Sumant Mishra's speech. Over to you.
A warm good evening to wonderful fellow Toastmasters and honorable guest. Good evening. So it's given me pleasure to evaluate a Toastmaster from other club, and I feel that it is a great opportunity for me, especially my target speaker, Dr. Sumant, on this. Managing the audience. Thank you. So thank you for the topic and for the chosen managing the audience. All the way I have observed is 10 to 15 minutes, a person who has ability to maintain control, composure, who faced all the disruptions and distractions. Kudos to you. I confused with your faces, sorry. Thank you so much. What a humor you have. And come on your preparation and structure. You begin with well clear objective. The content is 90% psychology, 10% treatment. I hope that's your content. That's good. Your opening was strong, and that set the rest. That's well. Engagement with the audience. You did a commendable job in maintaining eye contact and addressing different sections of the audience. You will stay focused on your message, though the questions is relevant to your message or irrelevant, you focused on your message. So hats off you. And you never ever ignore a single person. That means like you are focused on your message, whether you are answering promptly or impromptly, that is the another thing, but you are focused on your message. And your composure and confidence, for few negative questions, you handle with grace and confidence, and your humor sense was excellent. It's crucial to remain calm in that situation, but you did it. Techniques is used as, you were used several techniques. Though the session answering was impromptu, you stood on your feet for answering all those distractions. That's amazing. For a speaker of your caliber, my recommendations: clarity in voice. I felt little little difficult to understand your voice. What is the message you are conveying to the audience? That's the only thing I felt it. Maybe for me, if I speak if we attended 2 more meetings, I'll be used to it, get your voice clarity I'm saying about. And the tools, I have a doubt. One, you have used many tools. One tool you haven't used, I guess, that when you set your tools, you took us to us expectations, our expectations, something the doctor is going to speak about, 32 teeth, incisor, canine, molar, premolar. That is not. So you broke all our expectations and you took us to a really amazing humor session, I would say. And overall, managing different audience is not an easy, but you demonstrated with the pose, control, and effectiveness throughout your speech. I look forward to you to do the same in your upcoming speech and do it more better, incorporating those recommendations. And I would thank all the interrupters, interrupters, and I would especially thank Toastmaster Rafiq. Somehow he jumped into the picture. I was wondering, but thank you for all the interruptions. And over to you, Toastmaster of the Day. That's all my evaluation. Sorry. Over to General Evaluator.
Thank you, Toastmasters Sugna, for wonderfully giving the evaluation of the speech of Toastmaster Dr. Sumant. Now let's move to the next.
And coming to Toastmaster Sumant, he also used very good words and sentences such as analyze, audience are very special, triads such as tell, show, do, little thing matter, and so and so.
Dr. Sumant topic, he used a word called a TLC. What is the...
Also, we have Dr. Sumant. Big round of applause. This is one of the things. I'm sure that the guests today might have experienced this speech, because such an opportunity you will not get ever. And it is one of the highlight of Toastmasters, how to manage difficult audience. See how Dr. Sumant managed today. And that is the thing which we learned from Toastmasters. And I request all guests, this is what you are going to experience. This is one of the items which Toastmasters in his pathways has been established. There are many more to learn. Join Toastmasters and have that experience. And this is how you will not get such instances in your workplace or somewhere. Maybe you will get it at your home, I don't know. But this is something which Toastmaster offers. Thank you, Dr. Sumant. And the evaluation. Yes, we have Sanjana Gupta. Would you like to share a feedback on today's meeting, please?
Hello, Toastmaster. Nice meeting.
Do you have any feedback?
Lots of learning. Hello?
Yeah, able to hear, yes. Please go ahead. We are hearing you.
Yeah, nice meeting. Lots of learning. And thank you.
Thank you. Thanks for the feedback.
This is certificate for you.
This is your certificate. We'll send through Dr. Sumant.
Thank you.
On behalf of yours, Toastmasters, we have we have Dr. Sumant receiving your certificate on behalf.
Yeah, thank you, Toastmaster Anil.
Many congratulations, Dr. Sumant.
Thank you so
Wonderful.
much. Thank you, DTM
Thank
Ram.
you.
All of us through a lot of learning, and I thoroughly enjoyed this meeting. And as far as speech is concerned, there's two wonderful speakers, Dr. Toastmaster Latif and Dr. Sumant. And the great point is he also just talk about very good speech title, and Dr. Sumant, and from the medical field, how psychology affects. Really, this is the truth also. Many things, when we just saw the movie Munnabai MBBS, we know that, with human touch, many diseases can be cured. That's true with, children also. When children comes and their non-cooperation is very big, barrier and factor, and with that beautifully and with the difficult audience, he managed very well. I thoroughly enjoyed it.
Prepared speaker and all that. No? Yeah. Best speaker, any guesses? Yeah. Yeah. DTM Anil, can you give your feedback, please?
Well, let's complete this award first, then we'll give.
Okay, sure. Okay. So any guesses for best speaker, prepared speaker? Yes. Best speaker goes to Toastmaster Dr. Sumant Mishra.
Which tool should I use, Dr. Sumant? What psychology should I use, Dr. Sumant?
You are one of my mentors. As per your choice.
Congratulations. Thank you.
Congrats. Best